Hey there, everybody. I hope you're all doing well. My name is Brendan Persutti. Now, we've learned a lot about DMD in class this quarter, and in this video, I'd like to introduce another disorder with several similarities to DMD, and also discuss the issue of misdiagnosis, which can be deadly for individuals with either condition. X-linked adrenoleukodystrophy, or X-ALD for short, is a genetic disorder affecting the nervous system and adrenal glands. It's caused by mutation to the ABCD1 gene, which leads to a reduced number of adrenoleukodystrophy protein, or ALDP for short. This protein transports very long-chain fatty acids, or VLCFAs, into peroxisomes for processing or breakdown inside cells. Reduced presence of these proteins leads to abnormally high levels of these fatty acids in the body. Now, this triggers an inflammatory response in the brain, leading to a breakdown of myelin and damage to the adrenal cortex in addition. This results in a reduced ability of nerves to relay info in the brain, and also because of the damage to the adrenal cortex, it results in a shortage of adrenocorticoids. Now, this is an X-linked disease, so just like DMD, it preferentially affects boys. And also, similarly to how DMD can range in severity depending on the causal mutation, X-ALD has 4 subtypes with various degrees of symptoms. The first of the 4 is called the childhood cerebral form. This first manifests as learning and behavioral problems in ages 4 to 10. The child will experience difficulty reading, writing, understanding speech, or comprehending written materials, and also aggressive behavior, vision problems, difficulty swallowing, poor coordination, and impaired adrenal gland function, all of which worsen over time. In this form, extremely fast progression is common, and if left untreated, the patient only has a few years to live after the symptoms begin. The second type is called adrenomyeloneuropathy. This first presents between early adulthood and middle age, so a little bit later in life. It shows up as progressive stiffness and weakness in legs, urinary genital tract disorders, changes in behavior and intellectual function, adrenocortical insufficiency, with some severe cases also developing the cerebral form in addition. The third type is called the adrenal insufficiency form. This can manifest any time between 1 year and adulthood. Most affected individuals develop cerebral type features in childhood or adrenomyeloneuropathy type by middle age. Life expectancy really depends on severity, but this type is typically the mildest. And lastly, there's the asymptomatic form where the individual will not have any symptoms but may have brain or biochemical abnormalities which will show up on a scan. Individuals with this form may also develop other features later in life. Now, there is no cure for this disease, but some treatments are corticosteroid therapy or hormone replacement therapy to treat the adrenal insufficiency, bone marrow or stem cell transplant to slow or stop progression of changes in the brain, and then the doctors may also prescribe medications to relieve stiffness and seizures, as well as physical therapy. In addition, just like with DMD, gene therapy is currently in the works. Now that I've introduced X-ALD, let's talk about a common problem in the realm of healthcare: misdiagnosis. One trend we've seen in Duchenne muscular dystrophy is the benefit to a speedy diagnosis. An earlier diagnosis means an earlier start to preventative treatments, which can really go a long way in slowing down its fatal disease progression. This makes an improper or untimely diagnosis especially brutal. Although DMD awareness has much improved over the last decade, it remains a relatively uncommon disorder, something that contributes to the likelihood of a misdiagnosis. The same is true about X-ALD. The rapid degeneration that occurs following the onset of symptoms means that time is of the essence. However, X-ALD's variety of manifestations can make it tricky to diagnose. A 2019 study published in the journal Parkinsonism and Related Disorders stated that for that same reason, patients with ALD are easily misdiagnosed as hereditary spastic paraplegia, which is a group of neurological disorders that affect upper motor neurons. You're probably asking yourself, what can be done to combat misdiagnosis? Here are a few strategies. With respect to healthcare professionals, a careful and involved diagnosis is vital. As we've discussed earlier, X-ALD can be easily confused with other disorders due to an overlap of symptoms. Unfortunately, this is also the case with many medical conditions. It's easy to understand how arriving at a correct diagnosis necessitates dedication, thoroughness, and caution on the side of the doctor. Improved communication between the healthcare professional and the patient can also reduce the chances of misdiagnosis. Arriving at the correct prognosis requires being able to see through an often bewildering maze of symptoms to determine the root cause of pathology. This can be difficult enough with all of the proper information at hand. Finally, utilization of genetic testing, which is becoming cheaper and more widely available, can bring about a speedy and accurate diagnosis by pinpointing the cause of hereditary disorders like DMD and X-ALD. On the flip side, patients must practice self-advocacy. Communicate your issues and concerns, provide accurate information, keep track of details, and follow through. Also, don't be afraid to get a second opinion if you feel that is necessary. To sum it all up, X-linked adrenoleukodystrophy shares several characteristics with Duchenne muscular dystrophy. Both disorders are fatal and progress quite rapidly if not treated early. This makes a timely and correct diagnosis of utmost importance. Finally, the misdiagnosis of X-ALD is a serious issue due to its manifestation being similar to other neurogenic disorders. However, there are many strategies to combat this problem, with the most tangible being the use of modern genetic testing. Thank you so much for watching. Take care.